What's up, y'all? Rayshawn here. Welcome to another episode of In the Wild. And today's episode is going to be pretty interesting because if you're unfamiliar with AU, we clearly love the health sciences as we are known for being a health sciences university, but we also have a very strong liberal arts side to us as well. And for today's episode, we're going to talk a little bit about how we blend the arts and the sciences together because in so many ways, art can be involved and is involved in the healing and in healthcare. And so we have two professionals to talk to in different areas of how art helps heal people. So first up, we have Dr. Amanda Behr, and she is the department chair for our medical illustration program. So Dr. Behr is very impressive in a lot of ways, and you'll get to learn about some of the ways that she's so impressive. But from the work that she does and helps with creating students to become medical illustration professionals, because we are one of 4 programs in the nation, which is really impressive. And then for our second segment, we have Caitlyn Graham, who's an alum who's actually an art therapist. So she works hard every day with patients in their healing in so many different ways that you'll get to learn about as well. And she's very impressive. So I'm excited to talk to these two ladies, and I hope you're ready, Jag Nation, because here we go. Welcome, Dr. Behr, to In the Wild. We're so excited to chat with you for a little. I guess for medical illustration, in a way, it's kind of niche. So can you talk a little bit about how you got into the field?
Sure. I'm happy to be here. Thanks for the invitation. So for me, my pathway started at the University of Georgia. I joined the scientific illustration program there. And one of the alum from the program that I teach in now was my professor. And so
wow.
I had a great foundation, and he knew what it took to be a medical illustrator. And so he prepared the students to come into this field. And so I applied to graduate programs. And that's really the next step. So after an undergrad degree, you need a master's degree to be a medical illustrator.
For, I guess, you just growing up, were you always interested in the arts? And how did, I guess, science become a part of that for you?
Sure. I had, my mother actually painted when I was a child.
Oh, nice.
And so I always would bug her to paint with her. And so I remember painting when I was 7 or 8 years old with her. And so I had that foundation in art, and science also very, very much interested in me. And I didn't want to have to make that choice. And funny enough, my mother went to MCG. She's a physician.
Oh, wow.
And she knew about the medical illustration program because her landlord was one of the professors in the graduate program here where I teach.
Oh, small world.
It is. It's this circular pathway, and everything seems connected. And so when I was a child, my landlord was one of the professors in the medical illustration program. And so my mother told me about it, and after some consideration, I thought, that's really the path for me. I want to not have to choose between art and science. I want to help people with my art, and so that's really what led me to the path of medical illustration.
Did you ever think from your landlord and from your mom's experience that you would be the chair of the department here?
No, not in a million years, but it's amazing where life's path takes you, and what a wonderful opportunity I have. I'm just very grateful.
Yeah, because with our program, we're only one of few in the country,
yes.
Right?
Yes, absolutely. We're one of 4 accredited programs in the United States. There's also one in Canada. And I mean, it's such a rare opportunity to find this gem within an academic medical center. So I'm excited to be part of it.
So I have somewhat of a fun question for you. Do you remember the first medical illustration you created?
Ooh, yes. From medical illustration, I do. I just remember it was that first project in grad school. In undergrad, I created what I considered scientific illustrations. And that might take me a little remembering, but I remember the very first project that I created was a carbon dust piece. And carbon dust is a very traditional technique in our field. And I created a hip bone, basically a still life of a hip bone. And what's funny is now where I am teaching, I teach that technique to our students. It's the very first project. When they come in, they're also doing carbon dust, and it's of a skull. And so it just is this great way to enter the field and transfer those skills from undergrad art training to graduate training, because all the students that come into our program can draw well, and so they're taking those techniques of drawing but applying it to carbon dust. And carbon dust is essentially painting with powder. It's a carbon powder. And so it's a little combination of painting and drawing together.
That's pretty cool. How do you, I guess, because when I think of art, there's so many different ways to be creative when it comes to art, with drawing and painting and all of the different techniques. So how do you, I guess, work with students to take their style but also make it scientific, I guess, if that's the right way to phrase it?
Sure. That is one of the differences between, I guess, fine art and illustration. And one of the things that we talk about with applicants whenever they come in for interviews is what really makes them happy. Does it make you happy to tell your own story? Very often fine artists are telling their own story. Or is it more rewarding to tell someone else's story? And so be able to communicate your client's message. And so we always start with those main objectives. So what is the teaching purpose of this illustration? And that's the key. So if you can hit those main objectives, you've done a good job communicating to your audience. And so we start with communication. There is also some accepted technique or standard within our field where it's not basically to tell that story and to make that message clear. It needs to be a little bit tighter than sometimes our fine art allows. So we just step by step slowly increase complexity in each piece and teach them what the standard is for our field. And then over time, they may come with that style, but over time they develop their own style within medical illustration that does a great job teaching.
I like that because, I think for those who consider themselves artists, it's like, I do have my own style, but then for this is very specific in a way.
Yes. And so someone who comes in with a great sense of color, they can really cultivate that and explore and go beyond and use color to teach and share that message. So we don't stifle that by any means, but a lot of it's very clean and clear, so you can see those anatomical structures that are very tiny. And we talk about techniques to make things stand out. So the use of contrast, the use of selective color, and all those techniques build into a really successful illustration.
And what does, I guess, collaboration look like for you guys with other healthcare professionals in the field? Like, are they working alongside physicians, or like, what does that look like for you guys?
Yes, very often, basically the way that our projects are based in our program, we teach project-based learning, and so throughout the program, rather than having a course that goes start to finish in your skill building, you skill build with each project. And so those projects are based on real-world projects that we've had as faculty, and so we're incorporating that in, and we try to pair students with medical professionals or scientific professionals throughout all of those projects. And so, for example, we have a patient education assignment, and so we partner with Wellstar Hospital to create patient education brochures to help explain medical topics. And so we do collaborate whenever we can. Our students go to surgery and observe surgery, and so they're connecting with the surgeon even before they go in, just to be aware of what the procedure is going to be. And they go in and observe the surgery and get those sketches checked with the provider to make sure that they understand all the steps. And then they review the piece throughout that development. And then at the end, they have this beautiful illustration that was their surgery that our students were observing.
That's pretty cool that they get that the real world experience as they're learning and going through these projects like you mentioned, because that, hopefully by the time then they graduate, they kind of have a little bit of everything under their belt or seen a little bit of everything.
Yes, and our curriculum is a generalist curriculum, so we don't necessarily make students track into one area or another, and some similar programs to ours do track students. And so what we do is we expose them to basically every industry within our field, and then they can choose to specialize through an elective independent study type course, or they can choose to specialize with their research.
That's pretty. All like really fascinating to me because as someone that considers himself to be pretty creative, and I do like to paint and do other artistic expression in my free time. I think it's really impressive of how the science is kind of blended into that, and the impact that you guys have for just in the whole healthcare space. But for those who are unfamiliar, what would you, I guess, share for those that say like why we would need someone who is professionally trained at medical illustration?
Yes, absolutely. I think of us as artistic scientists in a way, and so the students and medical illustrators and graduate programs get such a foundation in the medical sciences, pathology, histology, all of this foundation they need to understand and communicate well with scientists and physicians and surgeons. And so having a master's degree in this field allows you to have the language and the understanding to be able to read very complex medical journals to understand a topic, and then take all of those words and create beautiful visuals that communicate. And so that science foundation is critical. And so I like to think of us as artistic scientists because we do get that foundational training in science. Our degree is a Master of Science. And then in our department, the medical illustration faculty teach the illustration techniques and the visual communication methods that are most effective in our field.
And that work is seen everywhere, from I would say textbooks to training other physicians. Even with the items that you brought today, do you mind walking us through some of the items that you brought?
Yes. So we have great examples of illustration work, but our work doesn't stop at 2D because we teach 2D illustration, 3D animation, but another area of specialty in our program is medical sculpture. And that is my particular area of expertise because I'm an anaplastologist.
Okay.
I make facial prosthetics for patients who have lost or born without noses, ears, eyes, fingers, and toes. And so what I'm sharing here is some of the physical models that we have. First, I'll start off with one of the beginning medical sculpture training projects that our students learn is how to simulate the feel of skin using silicone. And so this is a model that has the feel of skin, fat, and muscle. And so I don't know if you want to feel that. You can imagine that being part of your own body, how that feels so realistic.
Yeah, it does feel realistic, like you're touching someone. Yeah. And so they'll practice sutures with.
Yes, this is a model. So our students learn how to suture as part of our surgical techniques course, and they actually perform an operation on a cadaver as well. And so they understand what it feels like to suture on human tissue. And so then they take that knowledge and create an ideal simulation pad that can be used for medical students, other providers. And so this is a suture model, so you can practice different type of suture stitches, like a purse string or a long running suture. So that's really the assignment. I say, okay, make your ideal suture pad that you want to use in the future. And so that's what this is. But they take that knowledge and they bounce off and create these incredible simulation models or teaching models for patients and providers. One example is the past two Innovate competitions. Our students have done really well. So this past year, Abagaliz Mia Saladin won second place for her surgical simulator of a perineal tear, where during childbirth there can be a tear, and so it's great to understand how to suture in very definitive layers to make that process quick as possible for new mothers. And so she won second place for that incredible model, and it's based off of these same techniques, the idea of silicone and tissue dynamics, the way that it feels, and having that training in surgery that our students have, they can apply that knowledge to these models.
What is that like for you when you see your students to win competitions like Innovate and just, I guess, in general going off to do cool things? Because I know like a number of your students also will publish books and things like that. Like, what is that like for you to see?
It's very rewarding because, my greatest joy is to see a student be successful and have recognition, but also feel good about what they've created. And so Noah Smith was a student graduate this year. He created a children's book to help young kids who are going into the operating room to reduce their anxiety. And so that's a real world example of how currently it's being used in the hospital right now. It's being tested.
That's awesome.
Make sure it reduces anxiety, but he used his skill to create a children's book that, and he not only just made it and did what he thought was best, he actually went into the hospital and shadowed one of the child life specialists and understood what the issues were when children might have anxiety. And so that's what the work and the background work that goes into making sure these illustrations or these projects are effective and they teach and hit those objectives that I was talking about before.
You have a very impressive bunch of students. It seems like from the work that they're going through in the program, but also outside of that with, all the other cool projects like Competing in Innovate, publishing books, and so on and so forth, like I mentioned before. So I have another interesting question for you. What would you say is the difference between a good illustration and a great illustration?
Ooh.
Like what makes it great?
We kind of have this mantra or goals within the work that our students create and we create. Is it beautiful? Is it accurate? Does it tell its story? And so those are the things where to have a great illustration, it almost jumps off the page. And the use of color can be outstanding. The use of light on form. So does the light make sense? Does it have the roundness, the form that it needs to? And then is there an area of focus? So the illustration, very often in each step of maybe a surgery, there's a main point to that particular piece. And so does it draw the viewer into that central area? But really the most fundamental thing is, does it tell its story? Is it meeting those objectives? Because you can have a very simple, elegant illustration that is great because it does what it needs to do. It teaches that piece of science or that key information that a patient needs to feel comfortable with a procedure. So for me, it's great when it does all those things. It's beautiful, it's accurate, and it tells its story.
So for students who are maybe in undergrad right now or prospective students who haven't even started their undergrad journey yet, what would you say are some skills that they should consider, or I guess that background if they wanted to apply to become a medical illustrator?
Sure. So the keys that I think that we advise students coming into a program is the ability, a couple of things. So one is the ability to render realistically. And so kind of that beauty thing is what I was talking about, the light on form. So if you spend time observing still lifes. Still lifes is a great part of what we look at during our portfolio review whenever students submit work to get into the program. And so rendering still lifes accurately with skill and the use of light in those is really critical. And also we love to see those in color. And so beautiful application of color where the shadows are not black. The shadows are made with these complex colors that really warms up an environment or creates a sense of, beauty. And then if you can go a little bit further and tell a story with your still life, that's kind of like a chef's kiss. So rather than just putting objects on a desk, what is your narrative? What are you trying to say with that still life? Is it the flowers that you've chosen? Is it the objects that are placed there? So if you can tell a story with that, that's even better because we know that you're thinking forward to the next step of being a storyteller in the future. And then figure drawing is a really key part of the portfolio process as well. Being able to render the human figure accurately, and this goes to light on form again. having great lighting in the studio, spending time making something accurate, because our students go into surgery and they're very quickly sketching the surgeon's hands as they're moving. And so gesture drawing is one of the figure drawing methods that we want to see, because that tells us how quickly and accurately you can render a form, and that we believe translates into going into surgery and being able to sketch very quickly. But also having really long poses. The long poses tell us how accurate you are and how well you render light on form. And drawing every day. So if you're not drawing every day, I would recommend it.
But that makes perfect sense. I remember TV writer Shonda Rhimes had mentioned like writers write every day, and so when you said that, that makes perfect sense. Of like, hey, if you want to go into this field, you're gonna need to draw every day.
Yeah, and drawing from your imagination. That was the point that I was going to mention. So it's really important to be able to draw from your imagination as well, because in medical illustration you cannot see everything. So it's great to be able to render realistically what you see, but we're dealing with molecules and molecular environments that don't exist. And so being able to make something from your head and render that is very important. So I think of it as imaginative realism, where you're imagining what's real. And you can look at reference. You can combine critters and cross them together, or, dragons. It doesn't have to be medical or scientific. We like to see the creativity, and sketchbooks and sketching every day is a great way to do that.
Yeah, for sure. And what would you say to someone who's watching this, whose mind just got like blown because they're like, oh, I didn't even realize that I could merge the arts and the sciences together. But now they may be interested. What would you tell them?
Ooh, come see us. Come visit us. We do tours. We would love to chat about the field. We have a national association, the Association of Medical Illustrators. And if, let's say, you're not nearby, you can search for a medical illustrator and see who is nearby and chat with them about their work, what they do every day, and get a better understanding of what it is like to be a medical illustrator. We have our prerequisites and the portfolio requirements on our website, so we encourage you to check us out there. Don't be a stranger. Come visit.
Yeah, definitely. Check them out, guys. And then last question before I let you go, because I always have fun with this question, talking to department chairs and deans. But if your program or department just had unlimited resources, what would be like the first couple of things you would either purchase or get? Like, what would you do if you just could get everything that you wanted, or the first couple things off your list that you would have?
Oh, wow. Unlimited funding. That would be exciting. So there is a 3D printer that prints in color and different hardnesses of material. And wow. I've seen some really beautiful medical teaching models printed from that. And so that's in the, couple 100,000 range. If I had unlimited funding and resources, that would be something I would explore because of its flexibility and its kind of on-demand teaching niche that it would meet. And another thing that I would love to see is the use of a VR room or VR cave. We have colleagues who are teaching in medical schools, doing simulated trauma exercises. Oh, wow. And so they combine physical environment with a virtual cave to create that realism. And so I'd love to see how we as a department could be partners in that type of development. So I would love to have a VR cave or something like that. And then lastly, the ability to have some sort of internship in anaplastology, because there are very few anaplastologists in the United States. I'm one of 40 certified anaplastologists.
Oh, really?
And the only one in the state of Georgia. And so being able to train more future anaplastologists would be incredible, whether that's a degree or an internship where our students can have further education. Right now they do shadow me and they do an elective with me if they choose to want to enter the field. And this is the nose prosthesis.
Oh, that's so cool.
And so, if we could have more faculty for that or more facilities for that, that would be incredible.
Yeah, this is awesome. Did you make this?
I did.
Yeah. Well, great job.
Thank you.
And thank you so much for chatting with me. I'm super inspired. I probably wouldn't make the cuts to become a medical illustrator, but I'm sure some of you guys watching would be. So be sure to check out the program online. Thank you again for being here, and y'all stay tuned because we got some more stuff coming up when we come back.
Hey In the Wild fans, I'm Allison Toney with Alumni Engagement, and I'm so excited to connect with you. As an alum, you're a vital part of the Jaguar family, and your journey with AU doesn't end at graduation. It continues to grow. Our alumni network is full of leaders, innovators, and trailblazers just like you, and we want to help you stay connected and supported every step of the way. Through our alumni engagement efforts, you'll find plenty of opportunities to connect with fellow Jags. Whether it's through the signature events like the AU Brew and Q, Alumni Weekend, or just following us on social media, we're here to keep you informed, inspired, and involved. Make sure your contact information is up to date so you never miss out on the latest news, events, or ways to get involved. You can do that and so much more by visiting augusta.edu/alumni. We're proud of all you've accomplished and everything's still ahead. Thank you for being part of the AU story, and remember, once a Jaguar, always a Jaguar. Go Jags!
Caitlyn, welcome to In the Wild. We're
Hi.
so excited to have you here.
Thank you.
So let's talk a little bit about your AU journey from, because correct me if I'm wrong, you studied psychology. And you're kind of involved on campus too. So let's talk a little bit about your AU journey before we get into the real theme of today's episode.
My AU journey started a little chaotic. I remember orientation day I came, there was like a mix up with my financial aid. So I wasn't even supposed to start. So I was like having a meltdown somewhere, and I can't remember who it was. It was a great person on campus. It was like one of our like campus advisors came and like talked to me and like really set me up. So that was amazing. I started as a business major. I thought I was going to do business. I had no idea what I was going to do with it. I was just like, as a safe bet.
Okay.
Don't know what I want to do. So did that. Could not pass a math class to pass my life.
Yikes.
Like, college algebra, terrible. And then I was like, well, statistics, even more terrible. But I took a psych course as a elective, kind of just to like throw it in the mix to see. Loved it so much. That first psych class, the professor was speaking on her experience working in like with an art therapist in an art therapy setting in an eating disorder facility, and was showing us slides of the art that was made there, and that just stuck with me for so long that semester. And I was like, forget business, I'm over it. I don't want to do it. I want to do that. Like, I want to work in an eating disorder setting, and I want to do art therapy. Obviously, we didn't have an art therapy program, so trying to navigate what I needed to do and how I could get everything that I needed to advance to my master's or doctorates if I wanted to do that. So I was like working with my advisor. We were researching because she wasn't very familiar with it either. So it was a lot of like us both just doing a lot of research on what I needed. So decided to take the psych route, was majoring in psychology, and then I added the minor in art so I could get the art classes, because for art therapy you do need your psych and your art. So you can either major in art, minor in psych, or reverse. So I was like, let me do the safer option I felt, which was the psych major and the art minor. And that was like my journey of going through campus. I was involved in Black Student Union, which was great. Joined a sorority, Delta Sigma Theta, Sorority Incorporated. So that was great, just having like strong Black people around me to encourage me. I felt like I was a little lost that freshman and sophomore year. We don't want to talk about the grades. They were not cute, because I just was living at home. I never lived off campus. So I wasn't surrounding myself around people that were like actually studying. So myself was not actually studying. I would go home just like, work and then watch TV or movies. And that was kind of my thing, was neglecting my homework. So when I started getting more involved in like on campus hobbies and activities, I felt more empowered to like, I saw people around me, they were getting A's. I want to get all A's this semester. Like, it was very encouraging watching others around me. So got us together towards the end, and it was fabulous. I really enjoyed my time at Augusta University.
And look, the end is all that matters. It's how you finish.
Yes.
It's not how you start, it's how you finish.
Yes, absolutely.
But I guess, how did art therapy manifest, or like what about that field appealed to you?
Yeah. I think with me choosing business, I was being safe, but I always knew I wanted to like help people in a way. When I was in high school, I took a partners in art class. and I went to school in Colorado, so they offered, it was called Partners in Art, where we worked with the special education department, and we would do art with them. So that was our, or like side course that we could take, and it was their main course, their art. So I love that. I've always loved art. I've always had a love for art, but I didn't feel like I could go anywhere with art, like professionally and like just taking care of myself as far as being in that field. So I knew I wanted to help people. I knew I loved art, and just trying to figure out how I could do all these things, and trying to be like, oh, well, I'll just go the business route and figure something out later on. So when the professor introduced me, I was like, that's like my two passions right there. Like, I love that. I didn't even know that was a thing. Because it's not very big in the South, or even when I was in Colorado, it wasn't like a big thing that was talked about. I heard about music therapy a little bit, but never art therapy. So I was like, oh, I want to explore this a bit more. Did the research, and I was like, oh, absolutely, I want to do that. I feel a passion for both of these things, and I think they're both super important to like spread and get people involved in.
Yeah, because I think you make a great point where people who might consider themselves creative or artistic or just have a general passion for the arts, they don't think about like career pathways in
Yeah.
it. So what would you say to someone who might be feeling like you? Is like, hey, I love the arts,
Right.
or a certain aspect of art, but hasn't really thought about making that into a professional career?
I think now that I'm getting older and I'm seeing all the different things that are out there, there's so many different ways that you can incorporate being creative, or different like hobbies and interests into your day-to-day life, where you can make a living and survive, and also have that enjoyment of the things that you like to do, especially if there are people that really enjoy art and you like to help people. I would definitely encourage you to explore art therapy, because I get to do both of my passions. And I think even with me not being the main creator some days, and just like letting my patients create, it's inspiring to me to see how they think and how they're able to like put things on paper or in sculpture that I never would have thought of. So I feel like I'm every day being inspired in my job, which I love. So I don't like a mundane job. So I love that I'm able to like be inspired every day, see something new every day, meet different people from like all walks of life that I never thought we could have something in common, but finding that common ground within their art and my art and whatever else we like choose to share in that moment.
I love that.
Yeah.
So just kind of speaking of that, like what does your day-to-day look like? Or for someone who's unfamiliar, like what does essentially an art therapist do?
Yeah, so depending on the setting, so I work in actually 3 different settings of art therapy. So I do some virtual art therapy with IOP patients. So they kind of like step down to the lowest kind of form of like their treatment. And then I also work in a residential facility with eating disorders. And that's more long-term. They're needing a bit more support in that period of time. And then I work in inpatient care, which is they are like straight out of a crisis from the hospital to an inpatient facility where they'll stay about 5 to 7 days. And that's for them, for their safety and their support until we can find them, whether that's like an IOP program, a PHP program, or a residential program, deciding if they need to step up or down in care from that inpatient setting. So I'm in 3, so it looks a little different from both. In the inpatient setting, I would say it's more so making sure people are safe. They're able to identify like what their emotions are, maybe what led them there, especially people that are in active psychosis. As they're experiencing in that, they may not know in that exact moment why they're there or what's going on. So as they're kind of like coming down and returning to their baseline, that's when I get to see like a bit more of their personality, and the art therapy process can be a bit more effective for them, because someone that is like experiencing paranoia or they're manic, it's going to be challenging. So being more flexible in that setting. In my residential setting, I would say that's more like stable of like what art therapy would look like. So I have an art room. They come to me, whether it's group. I was doing some individuals. I've kind of stepped away, so I'm doing more group work these days. But yeah, so they'll come to me. We'll start off with like a guided meditation, or we'll do like an introduction to what we're gonna do, introduce them to the materials, I will either have a directive that I want them to complete, or maybe we'll engage in a bit more like free art expression. And each person has different preferences. So some people want a prompt, they want to know what to do, while others might feel more restricted with a prompt, and they just want to like create, but they want a little guidance, but they don't want like an actual prompt that they have to hit to a T. So being super flexible and letting them kind of have what they need to create, so they don't feel like stifled. I don't ever want to like make them feel like uncomfortable, like it's not a safe place to talk or share whatever they need to do. And then after they create the art, the most important part is processing our art. So encouraging them to share how they felt when they were making their art, what they would do different, what themes they see versus the themes that others or myself see in their art, and just encouraging moving forward for them to continue to make art.
I love that. And it definitely sounds like it's a role that keeps you busy in so many different ways. Like no day is probably the same.
Yes, no, absolutely not.
So how would you say, for someone who's unfamiliar, like how does art therapy differ from the traditional or more normalized talk therapy?
Yeah. So I think in any setting, and I'm starting to see more as I put myself in different environments, that a lot of like therapists that engage in that like traditional therapy do introduce art. They don't call it art therapy because they're not art therapists, but they do introduce art because it is a way to kind of like break the ice and comfort people. Because, you know, just imagine walking into a room and trying to share your traumas, your life experiences, all this with a stranger is very scary, even to the most confident person that was, willing to be in that therapeutic setting with you. And you can only imagine for someone that was forced or they were court mandated, whatever reason that brought them to therapy, they might not want to be there. So keeping that in mind of how can we make this person comfortable to share and get the best therapeutic benefits from this situation. So for art therapy, I would say, I feel, and I might be a bit biased, I feel that it is a bit more comfortable. It gives people a way of exploring themselves and their emotions and their traumas without feeling like they're like talking about it. So there's a lot of symbolism that we see in art therapy. We're using a lot of like our unconscious of what kind of came up in the art versus what we were intentionally putting in our art. And so many things come up for people that they didn't know, like, wow, I included that, and that's not even what I was thinking, but that did happen. Like this image that I've created is a representation of something that happened to me, or a way I want to express myself and my identity, and I can't believe it came out and I didn't have to share it. So this is a way that I'm able to communicate without verbally getting it out, especially with trauma. A lot of people, it's so hard for them to verbally express their trauma and share it. It's very triggering to them. So offering a different like modality for them to do that is very helpful for a lot of people because they are exploring it without like consciously doing it sometimes. So it's like, I'm just making art, but I'm also exploring like deep parts of myself that are very hard to address.
Yeah, and I think that modality can be very helpful because you're kind of giving them a task, either with the prompt or without the prompt, like you said, that can then lead them to talking about it versus, because I know as someone who professionally interviews people, some people are very guarded trying to, to talk to them. So just having that to help like build a rapport, break the ice, that does seem like it can be very helpful.
I agree. I think the more directives I come across, and as I try to get creative with different people that I'm seeing on a day-to-day basis, because everyone's different, they have different diagnoses, they're there for different reasons. Just trying to get creative ways to, like you said, build that rapport and get them to open up about things that they typically wouldn't want to in like a more traditional setting.
Can you talk about, without like sharing anything that's confidential, like any like breakthroughs or like really meaningful moments that you had with any patients?
Yeah, I've had so many. There's a couple activities that I really like to do in my inpatient setting where, especially with my adolescents who are maybe having a lot more, rather than like like experiencing psychosis, they're experiencing more like behavioral issues. We do like origami, and I really love to give them origami paper and tell them, and I always print like the most confusing instructions. Like there's no words, it's just like the folds. It's super confusing without any direction. So I will give them that, and I'm like, create this crane or create this butterfly. And it's always like an uproar, like, what is going on? Like I can't get it. And then like relating it back to their treatment. Like we can't do anything by ourselves. We have to have a step-by-step. We have to follow our treatment plans, and we have to, what does it look like when we do step 1, step 2, step 3? We're able to get to the final and create our final product, this beautiful thing. But when we skip from step 1 to step 3, like you may want to do at home, if you don't, want to listen to your therapist or your mom, and I don't like step 2. That doesn't make sense to me. I want to go to step 3. How our end product can be completely different. So that's like with that setting and that population, I like to do more like step things, because that's where they kind of are right now. They're working on the steps to get to a different facility or treatment that best helps them. In a residential, especially with like the eating disorder facilities, I really love this activity where we do our ED as a clay sculpture. So that's one that is always so amazing, and it makes me emotional as well, watching them create this. Like they get more tactile. They are able to have control over their ED for once. So they're making it. They're putting it in form. They're able to squeeze and abuse this ED as they feel it has done to them. And then afterwards, we kind of like explore it. We can put a name to it, and we have a fence outside, and I give them the opportunity to destroy it. Like you can now have control over this thing that has had control over you for so long, and we like symbolically throw it. And it's just so amazing how like emotional they get. Like it's not one throw. They go and they pick up all the little pieces, and they keep throwing it and smashing it and stomping it, and they all just like cheer each other on, like watching them like finally get that like heads up, or that like one up on their ED. So that's like one of my favorite activities that I do in that population.
So what is that like for you as a therapist to see them having those breakthroughs, those emotional releases, the growth? Like what is that like for you?
To me, it's super rewarding because, I would be lying if I said that every day I feel fulfilled. Every day I feel like the work I'm doing is important, because it's hard work, especially working with people with traumas and like these very serious diagnosis. They're not always going to come in and it's going to be a magical session and everything's perfect and you're like, oh my gosh, I feel like that went great. It's hard. Sometimes they give you nothing and they cuss at you, they yell at you, they're frustrated. And it's not that they're mad at you, they're just mad at their circumstances, and you have to kind of like meet them where they are. So when I do finally get to that point where I feel like they have had a breakthrough and we have had a breakthrough in that therapeutic setting, it's so rewarding to me. Like I'm doing important work, and that this field is so important to anyone that I'm, coming in contact with, and they might not have had that breakthrough if, our therapy, or if I wasn't there. We never had those interactions. So to me, it just like reaffirms that I'm helping people, and they're also being creative. Like I'm doing all the things that I said I wanted to do, from high school. So I don't know, I just feel super rewarded when I see these like breakthroughs, and I'm excited for them because I know that means there's another step coming. Like they're able to move forward from whatever it was in that moment that they were able to like break through. And
and hopefully from their experiences with you and the work that they're doing, they can like use those things again in the future.
Yeah, absolutely.
And you mentioned a couple different mediums like sculptures, origami.
Yeah.
What are some of your, I guess, favorite mediums to use?
So with art therapy, different modalities will actually bring out different emotions. So it's always really important to know what your patient is wanting to address and what their treatment goals are. Because if you give someone clay, it can, it's a great thing to use with trauma. It's a great thing to use watercolor clay, anything, especially in the field of art or in working with EDs. It's a great thing to use because we see a lot of control. They are really set on having control. So you want to challenge them with materials that are unpredictable. Like clay, I mean, to an extent you can get it where you want, but it has a mind of its own. It'll do what it wants. Same with watercolor. It might spill off the page. You can only control it to a certain extent, especially people that have no artistic experience. It's very hard. So you want to be careful of what materials you're introducing to people because they elicit different responses. So with clay, if someone has like sexual trauma, I probably wouldn't initially give it to them off the bat because it can have some like the sensations that could bring up some trauma with that. So maybe you'll give someone more, I don't know, more items that they're more, what is the word I'm looking for? They can have more control over, like a pencil or some chalk, or oil pastels gets a little messy too. Just something a little bit more simpler and they can have more control over, versus if someone is wanting to like challenge that control aspect that they have, then I would introduce like watercolor, pastels, charcoal, something a bit more messier. I personally love collage. It's not all my patients' favorites. Some of them hate it, some of them love it, because for someone who likes it, I'm like, oh, this is amazing. You can put a bunch of different things together. But someone who likes organization, collage might be super scary, because you're giving me 20 magazines, you're telling me to rip things out, cut things out, and put it all on this, 8 by 5 times 11 paper and create something. There's not enough space. I need my folds and everything to be perfect, and you're challenging them within like 30 minutes to get all this stuff done. They hate it. So I personally love it. I try to encourage those, but I don't want to force them. And I'm also a watercolor person, so I love watercolor. I get really good responses with watercolor and collage mostly, but not everyone likes it, but I do get the best responses, and I like the art that's created with it. But again, it's not about me, but I do like it.
No, that's very interesting. 'Cause that's something I would have never thought of, about the different modalities that would go into their treatment.
Yes. Mm-hmm.
That's really interesting. And kind of going off of that, especially with patients who may be experiencing like wanting to have control, I'm sure with some of them, even just like from my own experience with people or interacting with people in like a more creative environment, some of them are like, oh, I don't want to attempt this because I'm going to be bad at it.
Yeah.
Like, oh, I don't want to try painting because I'm not going to be able to paint it as well as you, or, so on and so forth. So how do you kind of work with them on that?
Yeah. So that's actually, I hear that every day, all day long. I'm not a creative person. I don't know how to do this. I don't know how to do that, before even trying. So I like to reiterate, and I even have like in my wall in the residential facility, like it's not about what other people think about your art. It's what you think about your art, and it's how you feel when you make it. And just kind of reiterating that when people come in, that this is not an art class. I'm not an art teacher. I'm not amazing at all art either. And you don't have to be. This is for you. You don't even have to share with the group if you don't want to. So this art is what you're doing in this moment. It's just how you feel. It's how you want to express yourself. There's no right or wrong. And even when I'm giving a directive, sometimes, like for example, if I said, draw yourself as a vase of flowers, and someone says like, I don't like flowers, or I don't know how to draw flowers. Okay, draw yourself in any way that's not human form. Giving them more freedom and meeting them where they are. So they might draw something they're a bit more comfortable with, or paint something they're a bit more comfortable with, and kind of giving that flexibility with it. But yeah, just mainly reminding them that this is not an art class. What you do is your own art. I'm here to see you. Yeah, and I learned from my in my master's program that to never create art unless they ask you to. Like if I'm with a client, if I can ask them, especially an individual, do you want me to paint with you, or would you like to just paint by yourself? Because we do have to understand that though I might say I'm not a perfect artist, and I don't think my art is perfect, they might think my skill level is more advanced than theirs, and that might make them shy away from creating in that moment. So always asking them, do you want me to create with you, like alongside you, or would you feel more comfortable doing it by yourself? If they say they want me to create, I usually just try to like do something. I might do the prompt, or I might do something more random. But I try not to create art with the patients, just for that fact. I don't want anyone to feel as though their skill level is not subpar for the group, and even when they're like looking with their peers in a group therapy, they're like, oh, well, theirs is better than mine. Just reassuring them that our art is individual and no one's is better than anyone. The fact that you put art on paper is amazing. You know, you have a final product. That's art. It's all subjective.
What do you think are some, I guess, common misconceptions that people may have just about art therapy in general?
Yeah. That it's an art class, that we're just doing art. We're not exploring the final product. We're not doing that processing piece. We're just creating art. And that's why I say like that most important part of art therapy is exploring our art afterwards. So yes, I want to give them the time to actively make art. I think that part is important, but we do need a process afterwards, whether that's as a group or through a journal, giving them a prompt to reflect on afterwards. And kind of viewing their art, having them explain to me what was going on there, sharing my kind of thoughts, if they would feel open to it. Because sometimes people think that you're criticizing their art, so you always want to make sure you're like giving these prompts of like, would you like my kind of interpretation of what you made, or what do you think why do you think you put this on there? What do you think that means? Kind of just like easing them into that processing portion. But yeah, main misconception is that it's an art class. I would say that it's not as therapeutic as like that traditional therapy. A lot of times the expressive therapies get neglected. We're not the main focus when it comes to therapy. And that would be my main thing of like, if I could leave like one takeaway is that I would encourage everyone to explore all different therapies, because therapy is not one size. So there's a million different types of therapy, and I feel like everyone should explore different kinds to make sure that they're finding the one that's the best fit for them. And yeah, I think a lot of people, when they think of therapy, they think, okay, I'm going to have to get on the couch, I'm going to have to talk to this person and, spill my, whole entire life to this person, or maybe virtual therapy is a big thing now. So get on the Zoom call, talk to the person. But there's a million different ways to do therapy, and art is definitely a very important one. You can explore your emotions and feelings with a paintbrush, with crayons, with markers. And also that adults can't do it. I think people think that art, I see this a lot in my inpatient when I'm working with like my geriatric patients or my adults with substance abuse.
Like they age out. Yeah,
they're like, oh, I coloring, like we're gonna color. And I'm like, yeah, be open to the markers. Why not? Like, what's scary? Like, let's dive into it. When's the last time you colored? Oh, that's amazing. Like 10 years ago? Okay, let's do it today. Like, this could be really fun. And I do get a lot of feedback of, oh, I'm glad I did that. Like, I'm glad I actually engaged in that, minus the the initial resistance. So, yeah.
Well, Caitlyn, thank you so much for coming to chat with me. I'm feeling inspired to be creative and explore some of my own artistic
you should.
passions. But yeah, thank you so much for
Of course, thank you for having me.
All right, y'all, I hope you enjoyed that episode. I certainly did. I love talking with Caitlyn, and I love learning from Dr. Behr about all the cool things the medical illustration program has to offer. So if you're interested, definitely check that out. Check out their website. And I wanted to just going back with my conversation with Caitlyn, just learning how art can be a bridge in so many different ways in someone's healing. So if you haven't already, I encourage you guys to try out some artistic expression and let me know if that helps you out in any way. I hope it does. We saw that in so many ways it does help out patients. So maybe just for your own self, you can try that out. So try that out. Let us know. And until then, I will see you guys in the next one. Go Jags!